afternoon to everyone here. It's a pleasure to be here. I'm Professor Don GREYDANUS. I'm from Michigan State University and Western Michigan University. Pleasure to be introduced by a very well-known child psychiatrist, Professor Fitzgerald here. We could spend the whole morning, afternoon, and tonight talking about ADHD because you all know all about it. So what I've done for you is the following. I have a slide set I put together very carefully. It's on mainly the adverse effects of medication, particularly stimulants, in treatment of ADHD. The art and science of treating children, teenagers, adults with ADHD. The art and science, it's easy to prescribe a pill, but the art and science and the true good clinician, it's the one who can deal with the side effects. My particular training is I did pediatric training at Mayo Clinic in Rochester, Minnesota, and then I went off to New York University and I studied teenage young adult medicine at New York University, Bellevue Hospital, and I hung out with and lived with some very wonderful child psychiatrists for half my time. Dr. Magda Campbell, Dr. Barbara Keller, a lot of people, and I didn't become a psychiatrist because I didn't want to give up I didn't want to give up my stethoscope. And so I'm coming to you as a professor of pediatrics, but with a lot of psychiatric background, ideas, but I stayed involved in not only writing about this field, but treating people. If you're interested in this topic of medical side effects, there's my email. Email me. I'll be happy to send you the slide set. At the bottom of the slides, I have updated references, sometimes the classic reference, but I have some updated references through December of this year, and I'll be happy to send it to you. You can look at it and then come to your own conclusions, because a lot of what I'll say is controversial. It's a matter of who you agree with, who you don't agree with. This slide set is now being converted into a journal. It's a journal which is published out of England called Current Psychopharmacology, and I'm editing an issue on side effects of psychiatric medications. We have different people, including psychiatrists. We're going to talk about atypical antipsychotics, ADHD drugs, anti-tic drugs, drugs for insomnia and so forth. We're going to look at these things very carefully. So this slide set will give you some introduction to that. I'm going to convert this into the chapter. And the purpose really is, we all know that medication helps kids with ADHD. Then we know there are limits, but there's side effects and problems, and that's where you get into some issues, and some of which have been debated by endocrinologists, psychiatrists, neurologists, you name it, for 50 years. It's fascinating to hear their different perspectives, and sometimes you can almost tell by the perspective of the person what they're going to say because of their training. So I'll be happy to send that to you, and you can decide what I'm saying. I am from Michigan here, and London has its famous bridge. Michigan also has a pretty famous bridge, not in the same way, but some of that. Greetings to you from my kids. These are my 10 grandkids. That means at least one of them will have ADHD, guaranteed. If you look at the epidemiology, so at least one of them, and maybe more, will have that. Nothing to disclose. I have spoken for pharmaceutical companies in the past, just to see if the research is true, which is if you speak for a company, you are owned by them. When they give you $1,500 for a half-hour talk, you are owned by them. You have to give it up. It's like almost too much alcohol or too much coffee. You have to stop it. And then you can sit back and say, okay, let me have a clear head and a perspective on what's being said. So nothing to disclose. The purpose of this is really to give you a little bit talk about the limitations of ADHD meds and how to deal with them, potential adverse effects. All medication has side effects. The trick is, can you deal with it if the medication is beneficial for that child, teenager, young adult, but they're having a problem with it, can you correct it in some way? And that's really the art and science, I think, of being a really good clinician. So we'll look at some of the side effects and some of the management of them. More important is not just to identify the side effect, but can you manage it so the benefit of the medication is still there? That's really what makes, I think, a true clinician. I want to take a big topic of adverse effects and maybe reduce it down to a little topic. Still dangerous, still tough, but manageable. Otherwise, it gets out of control. Your patient comes in very frustrated, family's very frustrated, and they go on to something else. Usually something you may not want. I'm coming from a pediatric perspective. It's a book I've done called Behavioral Pediatrics. It's what the pediatrician should know, if they're not a psychiatrist, about dealing with these medications. There's a world shortage of child psychiatrists. If you can find a psychiatrist to handle this, fine, but you probably can't. So we have to step in as pediatricians, family physicians, and provide help, because Professor Mitchell he can only see so many patients. And then he's plugged up, and he's off giving a meeting, and he's doing research, and so he's not available to us with his expertise. I've also come from the viewpoint of neurodevelopmental pediatrics, which includes autism. I've been part of a book that sort of looked at this whole topic. I've also come from different perspectives, but we all know that ADHD means there's abnormalities in the CNS, particularly the dopamine system, and we know that to a mild, moderate, severe degree, this child, teenager, and adult is having some degree of attention problems, which is interfering with their school, their work, their life, to the point that they need help. Impulsivity, which may or may not be a problem, and hyperactivity, which may or may not be a problem. This is a lifelong condition for most people. It may modify itself, and the patient may figure out as they get older how to modify some of this, or if they're very impulsive, they adapt their job to their impulsivity. And what happens as you get older into 40s, 50s, 60s, and beyond is these three characteristics change a little bit as you get older. The impulsivity becomes a worker who's very obstinate and hard to deal with. So it alters and changes, but it doesn't go away, unfortunately. And this is a book we did in a journal called Disease Month, looking at, it's a lifetime condition for most people. It doesn't mean it's a terrible condition, but even our internal medicine colleagues in America are finally realizing that ADHD occurs to their patients, and instead of only looking at myocardial infarctions and strokes and things, they have to look at this, because this does affect the life of a number of adults. It's a book we just did looking at intellectual disabilities and ADHD, book that was just published. So you can look at this from different perspectives, but this is in my perspective. Now, when we apply medication, we're not saying that you can't give educational and psychological treatment. It's very important. You don't want to only give the Ritalin. You have to look at that individual child and how they're doing at school, or how they're doing in the college, how they're doing at work. What's the problem that they're having in their life that you can perhaps use medication? So all of these educational, psychosocial, cognitive behavioral, they're all important. In the United States, the poorer you are, the less likely you'll get this, and the more likely medication, because you can't afford the rest. But giving medication doesn't mean this is all important. But we in the physician realm, we come from the viewpoint of medication. Today I'm going to talk about mainly stimulants and their side effects, but there's lots of other drugs and medications, as you know, that are available. Antidepressants are very good for some people. The alpha-2 agonists, short and long-acting, are very good. Atomoxetine, with the time before Professor Fitzgerald hauls me down with the mic here, I'm going to have to. This is a book that we just did, coming into second edition, looking at psychopharmacology. Again, what the pediatrician needs to know, not to be the psychiatrist, but we can't find them very well. So when we treat with these medications, the patient who listens to us carefully and reads our books and complies with what we're saying, you will find that their motor overactivity does improve. You'll find the impulsivity does improve. More importantly, you find that their inattentiveness, which decreases their ability to function in the work, school, environment, social situations, does improve dramatically. And that's the wonder of this medication. Hyperactivity, which is mediated through a dopamine activity in the nigrostriatal pathway, remarkable how for some people that they can change. Impulsivity through the cortical inhibitory glutamic inputs, amazing. This is amazing pathophysiology, which does work. But most importantly, it's the inattentiveness, which science has shown us in this area, which is remarkable. Now, the literature shows that if the person responds to stimulants, the neurobiology aspect increases dopamine, increases speed of information accumulation. It leads to motor calming in the ADHD child, if successful. It may improve even ADHD with aggression. Now, the antipsychotics are generally much better for aggression, but in some kids who are quite aggressive, treating their ADHD amazingly reduces that aggressiveness. Amazing for some people. It does reduce the impulsivity in ADHD children. Sometimes you get the opposite effect if it's not an ADHD child. It's even beneficial, again, for adults by increasing cortical connectivity. Do stimulants work on a long-term basis? We could spend the next hour discussing that, which we won't. The answer is yes, but it hasn't been proven. One article just came out recently looking at 8 years of effectivity in stimulants. It's just hard to prove. Most studies don't go beyond 2 years. But the fact that adults find these medications helpful, I think it can be useful as well. Now, if you want to know if something works, we all go to the Cochrane database. But the Cochrane database, they're pretty tough characters. Almost nothing impresses them. The Cochrane database people are like that professor or teacher you had, no matter how hard you work, you couldn't get that A, because this character wouldn't give you the top grade. So this is a very nice article done by Stora Bø, I think, in Scandinavia, who wrote a beautiful Cochrane database review in November in BMJ. Very good, but kind of tough. But even they admitted that there's a lot of benefits to ADHD drugs. One of our colleagues in Germany took them to task and say, look, Cochrane database, can't you lighten up a little bit? You're so tough on everything. Lighten up. It works. Yes. But even this group will say that there's benefit using the stimulants. What's fascinating about the stimulants over the last 50, 60 years is the following. Whether you like stimulants or not, the study of stimulants have forced the following information. This is beautifully summarized in an article in August in the chemical neuroscience literature. What stimulants have proven, beyond shadow of a doubt, it's elucidated dopamine signaling in how memory and attention works. Amazing stuff. It's demonstrated that a drug can have cognitive benefits. Wow, a drug, nothing else. Forget it, forget psychotherapy, forget that, no. But it's driven research in use of controlled drugs. You can give a long-acting drug lasting for many, many hours has effect. It was the stimulants that forced the pharmaceutical companies to do that research because of all the money that they can make. It stimulated the debate on impact of pharmaceutical sales, the tricks that our pharmaceutical companies use to get people to use drugs, fascinating research. And it's also forced even the most anti-medication person to say, well, yes, medications do work. So that's been really the benefit of the stimulants on psychiatry and things. A very good Cochrane database report came out in February looking at amphetamines and grudgingly admitted that even amphetamines improve people with ADHD, and you can read that report yourself and so forth. Now, what I face a lot, and you face, is I think this kid has ADHD. Why the heck doesn't the medication work? What's going on? You have to kind of break it down into the following. Well, you have the wrong diagnosis. Sorry. Go back to the drawing board. You have the wrong diagnosis. It's not ADHD, and stimulants aren't going to work. Try something else. Secondly, there's a comorbid condition like autism spectrum disorder, such as depression, anxiety, conduct disorder, oppositional fight. Something else is much more important. If you don't treat that comorbid condition, you can't get to the stimulant. So that's a very common thing. You're given the wrong medication, or you're giving it too high, too low. And the Royal College of Psychiatrists wrote a beautiful article, Professor Hall et al. In the British literature, saying use a stepwise titration. That's right. You start low, and you gradually build up to see what's going on. And that's the best way to do it. Or what happens a lot is the medication, the child has ADHD, so does dad. And he's taking the medication. Or Aunt Tilly, or grandma. Somebody is taking it because it helps them as well. That's very common. Some people have intolerable side effects. And you can work, we'll talk about that, you can work around it, but some people you can't work around it. And so you got to try something else. These are patients who are annoying because they don't read your books, they don't read your stuff, they don't listen to what you're saying, they go off in their own world. They even don't listen to Professor Fitzgerald, they just do their own thing. Annoying, but you have to kind of deal with that and try something else. The medication is being used for a drug of euphoria. I did college health for almost 2 decades, and it does lead to drug abuse in some people. Some people discover they can snort Ritalin. It's almost like cocaine. They can mainline it. They can use it for a drug of addiction. And There's some slide sets later about some of that. ADHD in general does not lead to drug addiction. It does not. In fact, as our colleagues in Boston have shown, it decreases drug addiction. But there's a small set of people who, when you expose them to stimulant medication, go on as a gateway drug to other stimulants, and those you have to watch very carefully. They're hard to predict. So in general, the issue on ADHD meds, it's very good. It reduces drug addiction, but is a subset that don't read your books, don't read your stuff, and they get in trouble, and you have to watch those people very well. They're addicting it. You have a lot of families, I don't know about in Ireland or in London, but a lot of families in America don't like drugs. They don't like it. And when the psychiatrist or the pediatrician pushes 2, 3 drugs on them, they don't like it. They're angry. You got to work with them on that, and maybe start with 1. But when you start shoving 2, 3, 4 drugs at them to treat their child's mental issue, they get pretty mad and they don't like it. Dr. McCracken has written very nicely about that recently. Some people don't respond to the drugs, but to say Ritalin, methylphenidate, but they respond to stimulants, or they respond to something else. So you have to find out their idiosyncratic response in that personal brain, that CNS, and the dopamine changes. How does that person react, and what's the best way to trick their brain into saying you can pay more attention and so forth? Or they don't respond at all to meds. Sorry, meds aren't the answer. You have to go back to the psychological thing. So those are some of the, so when you have a problem with a patient, try one of these things, and that's usually where you're going to find the answer. There's lots of contraindications to stimulants, as indicated here. You're aware of those. Stay away from it. Be aware of those. Check and screen for those, because it's hard to get around those. Now, if you're dealing with stimulant side effects, and the slide set goes into a lot of detail, and I'll go into some of that with the time I have left, but what you do is the following. In general, this is usually what works. If you have the right diagnosis and you don't have a comorbidity that's more important, you may try stopping the stimulant and give an alternative stimulant. Okay, I'm going to get you off methylphenidate. I'll try an amphetamine product, because you may do better with that, or a non-stimulant medication. That will help a lot of people in your practice. There's a lot of anecdotal evidence that is used, usually doesn't work. Be careful of your colleague down the street says, well, I did this, or I heard somebody say this at a meeting. If it's not research-based, be very careful with that. It may lead you down the wrong path. Some people have stimulant intolerance. You got to deal with that. So you use a non-stimulant med, like say atomoxetine. For some people it works. Or you may combine a non-stimulant and a stimulant. Some people, that help the side effects. That works for some people. If 2 meds or more aren't helping, reassess your diagnosis and look for comorbidities, or call Professor Fitzgerald and beg him to see your patient, find out what you did wrong. Now, any medication, what I always found that medicine was fascinating, every medication has a laundry list in the PDR of medications, like 150 things wrong. And when I was the first student, I thought, well, how do you prescribe stuff? Well, you get through it, you know what's common, and this gets into that. But what you have with stimulants, and I'll just go just a few minutes that I have left, and the slides that goes into detail. I've watched this now since I graduated from the Mayo Clinic in the mid-'70s. And I've studied this, and I've written about it, and I've listened to all the great professors over the years about this. There are some amazing controversies with stimulants. And I've listened to people, depends on who you are, but does it cause growth suppression? I have a whole slide set on that, and the answer is yes, no. Does it have cardiovascular effects? The answer is yes, no. Depending on what research you look at. Does it have medication abuse? Yes. Does it cause tics? It can. We have a professor on epilepsy. He can comment on that. But yes, it does, and no, it doesn't. And does it cause insomnia? Of course it does. So I'll go over this just a little bit. But again, if you want the slide set, stimulants do cause irritability and emotional liability in some people. Not most, but some. And there are some teenagers who put on it, and their emotional liability, their irritability gets worse. Get them off. It's an idiosyncratic response, hard to treat. Or send them to your favorite psychiatrist and see if they can deal with it. But it's limited, but it does occur. The risk of psychosis or mania is very, very, very low. It's rare, but it does occur. There's a few people, you get them on stimulants, and it brings out the psychotic. I don't know if it's a predisposition, but it's rare, but be aware of that. There's no data that I've ever seen that says stimulants lead to suicide. None. But a comorbidity problem may be depression, And that's what you're dealing with. So you got to watch that carefully. Stimulants do not make anxiety worse. They often improve the patient's anxiety. And the 2013 FDA drug label came out and said, look out about the rare priapism that can occur. Are stimulants a good sports doping agent? The answer is no. They usually decrease your ability to be a sportsman, but kids still like it. Does it cause epilepsy? We have a professor on neurology soon, and the literature seems to indicate that people with ADHD have a 2 to 3 times increased risk of having a seizure disorder. But the stimulants don't usually worsen the epilepsy. You can usually treat that. Santos' very nice study that came out in 2013 in the child neurology literature says that if you combine methylphenidate and with epilepsy, seizures are improved in most cases. About 1 in 5 seizures may get worse, but usually medication can sort of fix that. You can work with your neurologist on that if it becomes a problem. Now, big controversy about stimulants and anorexia. In the literature, the last 50 years says that yes, in many people, stimulants cause anorexia. They decrease the appetite, and seems to be a sympathetic activation process. Does it reduce over time? You can argue yes and no, and some people it doesn't. The literature on this is fascinating. It continues to come out. Even this year, one study said that if you take stimulants, your bone mass is decreased. Another study said your vitamin D levels are decreased. Another study said, however, you have less fractures. So you can play all with that. The answer is that with most people, many people, maybe 30%, will have some anorexia with some weight loss. So what you do is you screen for eating disorders, because sometimes they have ADHD and an eating disorder. And the stimulants may worsen your eating disorder. So you got to be careful with that. You take the medication with food. You avoid forced meals because you'll produce an anorexic in a teenager. You give frequent snacks. You give food supplements, calorie-dense food. You can usually work around that as long as you acknowledge it. Now, my time's almost up. So let me just go through this set briefly, and then I'll be quiet and give the other speakers a chance to talk, despite my threat to keep going. Does it cause growth suppression? I have a whole slide sitting there for you to look at. The answer is, and if you talk to endocrinologists in general, what you'll hear them say is that because of the anorexic effect, decreasing appetite, there are some kids who get stuck with less food, less nutrition, and temporarily they're not growing as well. And therefore, some kids may not grow as well. That's just a brief summary. Probably every decade since the 70s, there's been one major study looking at this. And the study, let me go through this here. This is the best study right now in this decade. Professor Elizabeth Arnstead from Boston. It's a beautiful study. She teamed up with a group at the Mayo Clinic and a group in Houston and looked at a 1976 to 82 birth cohort with follow-up. And basically, it was published in Pediatrics in 2014. It said, no, not an issue in most people, but they warned that there are limitations to the study. Every study has limitations. So what the European ADHD guideline group says, anybody on stimulants should be monitored with height, weight, BMI, appetite every 6 months, plot their height and weight on standard national charts, and if you get into a problem, get some help. American Academy of Child Psychiatry has a similar advice as well. Because remember, there are a lot of comorbidities. So some people can have ADHD and a primary short stature syndrome. So you don't want to miss that. Somebody has hypothyroidism, or they have a genetic syndrome, they have Williams syndrome, fetal alcohol syndrome, neurofibromatosis, whatever. Each patient's unique, and so growth can be a problem, but normally it's not a problem. Listen to the patient. No child wants to be even an inch shorter at the moment than they have to be. No teenager wants to be. So when they're complaining, get them off the stimulants, try the drug holidays, just get them off for a while and see what happens. And if they're still not growing, maybe you've missed something that you have to go back and do that. 4 minutes? 4 minutes, okay. Does it cause cardiovascular effects? I have studied this over the years, so I didn't give it my stethoscope, Professor Fisher. I wanted to be able to look at this as a physician still, not just a psychiatrist, no pun intended. And the answer is, yes, it has stimulant effects. I have a whole slide set on that. I go over some of the core studies that have been done, yes, no, yes, no, yes, no, yes, no, and there's a whole history. The FDA came out and said you need to, some years ago they said you have to do an EKG. Others people said you didn't. I spoke, Professor Joe, at an American adult psychiatry meeting in San Francisco a few years ago. There was about 1,000 people in the room, and they wanted to hear, because the FDA just said you need to do an EKG before putting somebody on stimulants. And so I was the one to get up and say, you don't have to do an EKG screening to stimulants. All you have to do is do a history. And if there's cardiac problems in the history, go talk to your favorite pediatrician or your favorite cardiologist and get an answer. Yes, it can occur, but in general, because just a screening EKG is worthless. It doesn't do a lot. It doesn't help you. You need the history. So, and there's a lot of research on that. The slide set goes over that, the up and the down, and what the FDA said. And the reason the stimulant came was there was a very, very, very influential child psychiatrist at a famous Midwest center. I won't say where, but he was the chair of the subcommittee for the FDA on this subject. And he felt very strongly, and still does, that there's major cardiac effects with stimulants. Well, he's a cardiologist. He sees all the worst cardiology stuff. He's biased, in my opinion. But he got the committee to vote 7-6 to say you need a screening EKG. The AAP went to the FDA and got him to back off. But still, the bottom line of all the research, and the slides go into a lot of detail for you about that, and there was a wonderful article by Shen in the Korea that was published in the summer of this year, went to a beautiful study. And basically, almost all the studies, except one by Vitello in 2009, have agreed that stimulants do not cause cardiac problems in the vast majority of people. If you get a screening history for cardiovascular problems, you're going to miss almost every case. However, there is an occasional child and adult who has a sudden death on stimulants, rare, and half of them have had cardiac problems, the other half we have no idea. So it can occur. It's rare, but it is unlikely. And there's always that little bit of uncertainty, and the slides go into that. Do stimulants cause tics? They can worsen tics in some people. Most people, it doesn't worsen their tics, it doesn't worsen their Tourette's, but a few people it can. So what you do is if tics develop, you can stop the medication, see if it gets better, get them on anti-tic medication, and you can say to the family, what's worse? Are the tics worse or the ADHD worse? And you go from, that's the art of medicine. What's worse? Most literature would suggest that the stimulants didn't cause the tics, they just maybe brought them out. But the tics usually are not a major problem. Medication abuse, you got some slides in there, lots of data for you to screen it if you want. I think the bottom line of all the literature that I've seen, and I've treated lots of kids with drug abuse, some have ADHD, most of the psychiatry and the substance abuse literature agrees with something like this, that, and this is also coming out of the Boston group, Dr. Biederman and Dr. Williams and a wonderful group there, that their work has pretty much stated that if you have ADHD and you get on stimulants early, that decreases your chance for having substance abuse later. And if you don't treat your ADHD, that does increase your risk for substance abuse later. There's also a few people who are on ADHD drugs and later they develop drug abuse. There's a subset of people who drink too much alcohol, get into cocaine abuse, on and on and on. That's that subgroup. We don't know how to quite identify them as well. You just have to screen for them. There are some people who on stimulants, but they get into other drugs. You just have to watch it carefully. But it's not a contraindication per se. Unless you find someone who's into major drug abuse, then it's best to keep them off the stimulant. Unless, again, their life is much more miserable. Does it lead to insomnia? And yes. A lot of people take on stimulants, they can't sleep. Like that, a cup of coffee too late in the afternoon, you can't sleep. Some people are very sensitive. But there's lots of other sleep dysfunctions which occur in ADHD that you have to treat, and restless leg syndrome and a variety of other things. So it gets you into more medication and such. So these are the controversies that I've followed over the last 40 years. They're all manageable. If you're interested in the slide set, I'll be happy to help you with that. The bottom line is, Stimulants are a phenomenally successful drug for many people who have symptomatic ADHD. It improves their lives in childhood, in adolescence, in adulthood to a remarkable extent. There are a lot of side effects people have. You can manage most of them. And of course, there are other medications as well, but I think stimulants have been a remarkable success, and I think that's why pediatricians deal with ADHD. Most people get better, and the side effects I think are manageable in most cases, and I'll be happy to answer your questions later. A pleasure. Thank you.